Everyone thinks that teens in our world today use alcohol, tobacco, or drugs to cope with everyday struggles. You may think they do,
but they don't. Welcome to the But They Don't podcast, a podcast for teens by teens. Join us as we cover substance use prevention, mental health, community conversations, and more.
What is up, everybody? Welcome back to a special edition of But They Don't. I am everybody's favorite elder millennial, Jessica, and today I am joined by Alyssa and our special guest, Angel. Hey, Alyssa. Hey, Angel.
We are releasing this episode today because it's International Overdose Awareness Day. It's a day set aside to remember without stigma those who have died and acknowledge the grief of family and friends left behind. Jessica is going to share some statistics and information with us. Then we're going to talk to Angel about her experiences.
Thanks, Alyssa. Before we do get any further, I do want to throw a trigger warning out there for everybody that we will be talking about overdose deaths for the remainder of this episode. So now is your chance to turn the episode off if you need to. And if you choose to continue listening, be sure to reach out to someone if you need that extra support. More than 1 million people have died since 1999 from a drug overdose. According to the CDC, in 2021, 109,179 drug overdose deaths occurred in the United States, which was a 15% rise from 2020. Opioids were involved in 80,411 of those overdose deaths, which is just over 75% of all drug overdose deaths in 2021. More than 4 times as many people died from a drug overdose than from homicide in January of 2021. The numbers for 2022 were staggering too, as preliminary data estimates that 109,680 overdose deaths occurred in that year. Specifically in South Carolina, where we're at, according to a report from the National Center for Drug Abuse Statistics, there were 1,127 overdoses in the state per year, which accounts for a little over 2% of all of the deaths in the state. The OD death rate is 22.7 deaths out of every 100,000 residents in South Carolina, which is 9.66% higher than the national average overdose death rate. These statistics are staggering and scary and sad, and we can experience a lot of emotions when talking about this.
But it is important that we talk about the stigma surrounding overdose. There are several types of stigma that can affect people's perception of drug overdose. 2 key types are social and public stigma. Social stigma arises from the collective dominant beliefs within society that regulate acceptable behaviors within a group. This can lead to the shunning of unfit members of the group or the need to coerce others into changing their behavior in order to be deemed acceptable.
Public stigma is created through stereotypes about people, for example, those who take drugs or have overdosed. These perceptions may be that they are pessimistic, have moral failings, or are selfish, which then translates into negative attitudes towards people who have taken substances that have led to overdose. In America, as well as globally, there is a cultural stigma around the term overdose.
The negative connotations attached to drug overdose often include the trope of a person with a drug history and a substance use disorder, whose tolerance level has grown to such an extent that they take more and more of the drug more frequently and resulting in a fatal overdose. Frequently, we find that healthcare providers, even therapists, view patients' drug or alcohol problem as their own fault, leading to the substandard care or even rejection of treatment altogether. It is not uncommon for individuals who enter emergency rooms seeking help from acute intoxication to be expelled by staff who are fearful of their intentions, like potentially seeking out prescription drugs. And their volatile behavior and care providers often exhibit a lack of empathy for a person who's overdosing due to stigma and blame.
It is critical for everyone to know that people who have a substance use disorder have a chronic disease that is treatable. The stigma surrounding this devastating disease keeps people from getting treatment and finding recovery. We must make sure that people wrestling with this disease, just like those fighting diabetes, cancer, or heart disease, are treated with dignity and respect when they seek treatment. We need to provide quality, effective, affordable treatment options in every neighborhood so every individual and every family has the chance to heal and recover.
We need to provide families and their loved ones with the tools and resources they need to help support them in their life of recovery. We also must work together at home and in the community to help eliminate the stigma around addiction and encourage those struggling with substance use disorder to seek help.
You can help right now by adopting non-stigmatizing language to describe people with this deadly chronic disease. A person who has stopped using drugs is abstinent, sober, in recovery, or in remission. A person with a substance use disorder who is currently using drugs or has resumed drug use after a period of abstinence is experiencing a recurrence. They have an active disease and need aggressive treatment to prevent overdose and death. Drug use is an emergency in substance use disorders, just like chest pain is an emergency in someone with heart disease.
Now that you know a little bit more about overdose and stigma, let's turn to Angel, who has a personal story about overdose deaths. Angel, thank you so much for being willing to share your story.
Oh, yeah, of course.
So, can you tell us a little bit about your son? What do you want the world to know about Levi?
So Levi was 24 years old. He was my only son out of my 2 children. He was my eldest. He had a huge personality, loved to laugh, very contagious laugh, huge hugger. He could walk into a room and he would always find the person that needed to be lifted up. I mean, you knew Levi was present because he just had a big personality, and he always made you feel very welcome. He was one of those kids that would give you literally the shirt off his back. I couldn't find half his clothes after he passed away. But he was that one that you always wanted to be around, that he loved to, I heard from a lot of his friends who would say that Levi was the one that would call them when they were down. He would just call to say, hey, what's up, make them laugh, and then he'd hang up and he'd just check on them every day. And that's the kind of stuff I actually didn't know was happening. So he didn't talk about himself like that.
Yeah. So do you mind sharing a little bit about the day that he died?
Yeah. So the night before, from what I understand, he had gone out with some friends and people he'd been hanging out with for years, from what I understand. And Levi did like to drink, and, he was of age, and he did like to smoke weed, which I knew about. And despite therapy, Levi still, struggled with that. But when he was younger, he had struggled with a pill issue, and so had gone through therapy. And so we, at this point, did not know that he had any kind of issues with pills again. So he had gone with his friends. I talked to him that night to kind of close out our Christmas list, because he died near Christmas. And he sounded good, sounded fine. Said, I love you, Mom. No issues there. Well, once I got out of church on Sunday morning, about 11:45, his father called me and said that we had lost Levi. And he had passed away about 5:46 that morning. And so what we have found out since then is that he was out with his friends all night. And at some point, one of his friends had given him a pill. There was 2 pills, actually. One was a Xanax, and then one was an oxycodone. And he had accepted them. He had had a wreck in October and had a back fracture and a dislocated shoulder. So I'm sure he was hurting, and I'm sure his friends who he trusted said, hey, I got you something to kind of help you rest. And, he knew better, but he still took it. And so he quit breathing. He went to sleep, started snoring. Whoever, his friend that he was with that night, heard him stop snoring. They went to check on him. He wasn't breathing. So EMS was called immediately. They performed CPR on my son for an hour and 15 minutes before they pronounced him. And that would have included giving Narcan, and it just wasn't successful for him. His pills were laced with fentanyl, heroin, cocaine, and meth. And those were not pills. I mean, that's not drugs that he did. And from what I understand from the coroner, is that when you see those multiple medications like that, those are always in the pills. They're not drugs that they just did on the side.
Wow, I'm so sorry. Can you tell us a little bit about the work that you've been doing since Levi's death?
So since Levi's passed away, the Lord had me wait for about a year, really, before I felt like it was something I could do. And so, I spoke on the documentary that Pickens Behavioral Health put out to give Levi's story to try to spread awareness about this fentanyl poisoning that we have now, that we're losing our children to. We have, there's a group of women that are being led by a lady named Kim, who has formed a group called Foothills Fentanyl Fight. And we have just had our first rally, August 27th, which was, I thought, a big success here in Easley. We're going to work on having monthly meetings just for support groups for us who have lost our children or siblings or whoever. This is open to anyone that this has affected. And then tonight, we are going to be speaking on a candlelight vigil, which speaks on all overdoses, but the majority of us now, at least here the last couple years, has been fentanyl related.
Yeah. Is there anything that you want to share with teens who listen to this episode?
My biggest advice would be, don't take medications that are not prescribed to you. Don't just trust your friend that this is something that is safe. At this point in life and the way the world is, I don't know that I would take Tylenol from a friend. It's getting that dangerous, but I definitely would not take anything that's not prescribed by your physician, picked up at the pharmacy by you. That's going to be super important, and to share that with your friends. And if you're having issues or thoughts or any kind of wanting to harm yourself or whatever, just make sure you're reaching out and talking to somebody about it.
Yeah. Thank you so much for coming and talking about something that was devastating and turning it into something positive and making sure that Levi's death is not in vain.
Thank you.
And I think it's really important to point out, too, that these overdose deaths are not just occurring from people choosing substances like heroin and cocaine and all of the illicit substances that you can buy out on the street. Just like Levi's story, he thought he was getting one thing, and it ended up having stuff in it that took his life. And so no matter if you're experimenting or if you've never done it before or anything like that, just like Angel said, it's so important not to take something unless you yourself know exactly where it came from. Because even if you trust the person that's given it to you, whoever gave it to them may not have had the best of intentions. So that's the message we're trying to spread today with International Overdose Awareness Day. We are losing people far too often, and it's sad and it's preventable, and we want to spread the awareness that comes from that. So, in fact, if you are local to us in Pickens County, Behavioral Health Services is co-hosting the Candlelight Vigil tonight with the Foothills Fentanyl Fight at the Pickens County Courthouse steps. We're going to begin right at 7 o'clock. If you are local and want to honor your loved one who you've lost, we will have a memory table set up. Bring a picture no bigger than an 8x10 to set out there, and we will have candles provided as well. I know I've seen a couple of people ask that, so wanted to throw that out there too.
We hope you'll tune in starting next week as we start a series of episodes for Suicide Prevention Month.
And as always, be sure to follow us on social media to stay up to date on all things PCYB. We're on Facebook at Pickens County Youth Board and on Instagram and TikTok at We Are PCYB.
Thanks, guys.
Thanks, Angel, for coming.
Oh, you're welcome. Thank you for having me.